Good morning, everyone. Welcome to the Demonstrating Implementation Excellence stream at SNOMED CT Expo 2025. Thank you to IQVIA for sponsoring this stream. My name is Victor Medina. I'm a senior terminologist and CSRM lead for LATAM at SNOMED International, and I will be your moderator for today's session. We'll address all questions at the end of the presentation. For our online audience, please use the Q&A button to submit your questions to the presenter. For those attending in person, feel free to use the microphone provided in the room when the time comes. It's now my pleasure to introduce Jørn André Jørgensen from Novari and Eirik Nicolas Lunde from Contair. They will be presenting SNOMED on FHIR in Norwegian Public Dental Service. Jørn and Eirik, over to you.
Thank you. Thank you very much. Thank you for having us. It's a pleasure to come here to Antwerp and to be able to tell you about how we're trying now to implement the work we've been doing for a few years. We have been talking previously about some of the theoretical basis for what we're now showing, and this is the first pilot implementation we have. So I'm going to start showing you the goal of the project we're currently running. So I know this is possibly not where we're going to end up, but because it's quite ambitious. But what we're looking for is we're looking for a system where we have an app layer which we could buy from different vendors for different functions, all working on top of the national information service, health information sources and services. Like we have a core chart, we have document sharing, medicines, and we also have the administrative systems inside the counties, like HR, accounting, things like that. And what we're going to talk about today is the storage and exchange from the EHR in dentistry to a common standardized storage. So this is pretty much the core of what the idea today is about, talking about how we're trying to move data from a proprietary system into a standardized storage, showing them in other applications and using them for analytics based all on FHIR profiles and SNOMED as value sets. So at the beginning now, Eirik here will go through a part of the more technical sides of things and how things are actually solved in the pilot, and I will come back with some of the use cases at the end.
Great. Yes. Yes, I will go through some of the technical stuff we have done in this project. As you can see here, here is the system architecture. So I will go through the parts of this. So first part is dental record, where the dentist register the information about what's done. This information is stored in a dental database. So this is some of the key part of what we have done in this project is a data transformation API. It takes data from the database and converts it to a standardized form. So the first thing we're doing is mapping it to SNOMED, because the dental record uses a lot of local codes, which is not understandable for other systems. So we need to map it to SNOMED CT. And after that, we convert the data to a FHIR format and post it onto a FHIR server. In addition to this, we also made some FHIR profiles to specify some rules of how the resources should be used and which elements should be included. And at last, we have made a dental record simulator to illustrate how the data flow can, how the data goes from one system to another. And then it gets the data from the FHIR server. So I'm going to go a bit more into the details. The data transformation API takes the data from the database, as I mentioned. So the data looks something like this. This is just some test patients which we made. And as you can see, it is a lot of local codes for both the procedure conditions and things that have been done with the patient, also for The tooth and the surface has some local codes. So first thing we're doing is mapping it to SNOMED. So we're taking the unikey and sorting out if it's a condition or procedure or other hierarchy and mapping it to SNOMED. And then we are mapping the tooth, and at last we're mapping the surface to specify which part of the tooth it's affected. And after this, we're combining it to a post-coordinated expression, as you can see at the bottom here. And after we have mapped it to SNOMED, as I mentioned, we're converting it to FHIR. So this is an example of some of the elements we include. We're taking, for example, these elements, name, birth date, and include it in a patient instance. In the middle here, we have a part where we make the condition or procedure instance, where we include the post-coordinated expression, some text and date. And also we have encounters for all the encounters where things like date, which dentist was doing the examination, and things like this. And what's nice about, or a central thing about FHIR is the references between the different resources. So for example, the conditions we are making is always connected to a specific encounter, so you can see what's done in the exact encounter. And of course, everything is connected to a patient. As I mentioned, we have made some profiles, which is specified rules on how to use the resources. I'm not going to go very much into the details, but one of the important things to see here is, or one of the central things we've done is to slice up the coding element. So it's sliced in both a pre-coordinated expression that you need to have, but in addition to this, you're also allowed to have a post-coordinated expression. I will show you a concrete example of this. As you can see here, at the top, you have a post-coordinated expression, and at the bottom, you have a pre-coordinated concept. And these are the same. In addition to this, we have made some body sites to specify the tooth. So as you can see, the tooth and the surfaces both included in body site, but also in the post-coordinated expression. So this part means the same as the post-coordinated expression. And this is just to make the solution a bit more flexible for other systems. But in addition to this, the post-coordinated expression can give us some added value. So for example, this part of the post-coordinated expression can give us some added value about, in this case, what using material was used for a restoration, like gold, which can be really useful to be able to add. Yes, and Jørn André is going to take you through the dental use case, but I will just show you briefly how the dental record simulator is functioning. So we are taking the data from the FHIR server, and then we're able to get the dental status and sort out the teeth that's been affected, as you can see here, some examples. So let's go ahead and add a condition. First, we choose the condition. We choose dental caries, for example, and then we choose the tooth that's affected by this. And then you can see on the right side here a description that's combining the different elements, and also we're combining it to an expression. And this is sent to a Snowstorm X server and validated. As you can see in the green marking, it's getting a validated status. But we can go ahead and add some more information about which surfaces that's affected. And then you can see here, it's added to both the description and also the expression. And then you can see that it's not validated anymore, so we need to post this to the Snowstorm X server and check if it's a valid expression. So let's go ahead and do that, and then we get a validated expression. The next part is to convert this to FHIR format. I'm not going to go into the details here, but we use a condition resource. So you can see here that we include the expression we just made here in the FHIR. And then we're able to see this tooth, 21, marked with the dental caries, as we said. And an important notice here is that we use the post-coordinated expression to mark out which tooth it is, and also what parts of the surface that's going to be marked. As you can see, the two red marked surfaces. Yes, Jan Ole.
Thank you. Very good, Eirik. So I will show you some of the advantages this gives us, especially the parts. I hope you noticed when he did the part where he said, well, we're doing both in FHIR to ensure sort of backward compatibility with those who can't really manage terminology service. But then still, you open the world when you have some additional information. And we have shown in previous presentations how that could be done on the data. But I will now go through. So this is just showing you two images, just to show someone that, yes, it is actually transferring the same data in the correct way from the proprietary EHR. And that is important. I mentioned the goal of the project I'm in. So the goal is to establish a new, fully integrated dental EHR solution for all public dentistry in Norway. That sounds really large. An entire country is going to do something. Well, I think it's the size of Antwerp, and I'm not quite sure. So we're talking about 1.5 million patients, but it's still a lot. And we're talking about 3,700 healthcare personnel who's going to use that solution daily. They're currently working in a graphical interface like the one you see on the upper left. And it's not a bad graphical interface. And I mean, having nothing else, well, they're using proprietary coding. When we go through the project, part of the goal of this pilot is to have a foundation that we can tell the vendors, well, now you're going to use SNOMED natively inside that EHR. We're not going to do mapping. You have to use native SNOMED, and you have to post-coordinate into our services. And that's the part of the beauty of having this large procurement from the entire sector. But anyhow, if you see this, oh, sorry. As you can tell, I can't move around, but there is a tooth that is circled on the lower left, right in the demo app that Eirik showed you. You can see that has almost exactly the same graphic. We're just choosing a little bit of different color, just to have the difference between something that was there and something I put in there. In the other one, it's the same color. But that really doesn't matter. These are representing exactly the same procedures and findings, and you can view all of them. A huge problem in Norwegian dentistry has been patients moving. I guess that's the same in every part of the world. So someone moving just across the border from one county to another, you lose history. So this was one of our use cases where we said, we're going to use a pilot implementation. Now we've created two patients, two different databases, of course, the same vendor, but they're entirely different databases. You can see the tooth over here. I put in a cavity. It's a red number 3. It just means there's a cavity and someone's going to drill it. And that's in one EHR. And as it happens, the patient was on holiday, so the filling was drilled and filled by another dentist. If that happened in Norway, across counties, or in different private practices, things like that, you would never know that those two are connected. And if you tried to get a dental status, you would get conflicting data. But putting this into the HAPI server and showing it in the simulator, you can see that the tooth now has a blue box, which indicate that this has been filled, but still it has the history of having a cavity from the first chart. And this is what FHIR with SNOMED really enables us to do. Could probably do it elsewhere in other ways as well, but it already has a system that makes this work. We also tried to do something with text recognition, and this is sort of early development in our world. To me, it's a new idea. As a physician, I'm a bit anxious to say, will it actually recognize what I was talking about? I could possibly trust it with analytics, but can I trust it with my life? So just to illustrate, and if you want the previous presentations we have done on this, please feel free to seek them up on YouTube. That will talk a lot more about the RAG bags and the precise information, things like that. And one of the challenges we have is that we have free text in a RAG bag. So oral M means oral medicine. And we can only say that's a finding of mouth region. That's the only knowledge we have about that. The rest of it is free text, totally unstructured. Well, trying to use this, we tried just to say leukoplakia, right side of tongue. And it finds leukoplakia of tongue. And now we can enhance coding from a RAG bag into a more precise using terminology-supported large language models. And this really gives us the benefit of being able to convert our data into a more structured manner, waiting for the proper solution where you actually have terminology-supported charting of free text. And by that, I mean something like along the lines you have on Google today. You start typing something and it tries to recognize what you're saying. I really can't understand why that's so hard in healthcare, but it's another issue. And we also did some analytics, and I think I'm moving towards the end, so I'll worry about time. And we have also previously shown the use of R on the data, and then we showed it on a lot of data. But that was using an SQL database. So we converted the data to SNOMED, but we still put it in an SQL database. And we only had limited support of Snowstorm X on the backside. So this is only 10 patients. So the graph doesn't really look so magnificent. For those of you who can appreciate what's on the backside of this, we did 10 test patients. We chose 4 of them. We created a history for each one of them by charting something every day for 5 days. We should, of course, have a lot more. Then we just put it, we didn't go on the SQL server or anything on that. We put R directly onto the FHIR server. And we used Snowstorm X for both filtering the data, for cross analytics, for saying, okay, if I want to show all carriers, it's the red line. All carriers doesn't exist in our data. Carriers in dentin exist, carriers in enamel exist. And now it looks like this is only for dentistry, but you could use exactly the same in medicine. You could say, well, I'm looking for all heart attacks, not that type or not that type, and I can differentiate them. I could look for all fractures, or I could support only spiral fractures. So looking at this, dentistry modeling in FHIR and SNOMED is pretty much exactly the same as you would do in a lot of medicine, at least a lot of somatic medicine. Possibly not as much in psychiatry yet. So you could do exactly the same. So we have all carriers, which is actually a lot of different expressions. But we use Snowstorm X to say, this is what we want. Then we differentiate and we say, give me all dentin carriers. Okay, that's carriers with a finding site of dentin, any part of dentin. And that's the green line. And then you have enamel carriers, which is the blue line. Now, this enables us to see how quickly disease progresses from enamel to dentin. We can also see what kind of treatment is done for the different levels. And we can dig in and we can say, okay, now we see something that really doesn't add up. Can we see what's underneath? Because having those post-coordinate expressions, that gives you a lot of precision. You can collect them up in a value set or a vector in R without any issues using Snowstorm X on the backside, especially since everything is already classified. And then when you get those data, you can extract them and then you can differentiate and see what's underneath. So as mentioned, I'm not going to show you today these. We have also these data based on 300 and blah, blah, thousand patients. Our next goal now is, of course, so I'm going to move all the way back. Sorry about this. I should have put the original slide at the start. I'm going to go here. So our goal is, if we get this working, and we're able to take the electronic dental record and store it directly into common standardized storage, and we're working with that as we speak, we could push all our data, 1.5 million patients, into a common storage and put analytics, Power BI, R on top of it. But it has some extremely important prerequisites. You need to have a terminology service. You need to have proper profiles, not extensions into everything that makes FHIR unrecognizable from FHIR. Please do not extend a lot. Use SNOMED for the terminology semantic content and use post coordinations and SNOMED. That's what we're going to do next. And hopefully we can show you the same kind of graphs based on the entire Norwegian population. I'm not going to click all the way forward to questions again. It's really bad TV. Thank you so much, everyone. Any questions?
So thank you, Jørn and Andre. Now we will begin the questions period. As a reminder, if you're in the room, please use the mic provided here by Piet. So any questions? Kelly.
Just wondering when you're thinking your timelines are. So, I mean, I think we've been able to see a little bit of evolution of this over the last couple of years, and every time you're very good about keeping us up to date of what point in the project you're at. But when you look at actually getting those 1.5 million patients within that common standardized storage, what are you thinking in terms of the runway to actually getting that to operational?
2028.
2028? Okay.
Yeah, and just a quick comment on top of that, because we're not looking at this goal in 2028 because we don't believe in the apps, everything. We think a huge vendor is going to say, well, we have it all. And we're just going to tell them, okay, you might have it all. You may keep your own SQL database. We really don't care as long as you put everything in the green box. So sort of a merge of the ones on top, but still keeping them there. We're going into procurement next year.
Thank you very much, Jørn, for this presentation. A year or two, we had some interviews done with all the vendors in dentistry in Sweden, and we were interested to see how it looks like, how do dentists document the patient data every time they visit the dentist, and so on. And I was wondering, and they were very skeptical about structured data. They said, we are already structured. What do you mean by structured? I mean, their information look very structured. They are sending data to our registries very regularly, so they don't understand it. And then we started to show them how information modeling can help them to gather data in a unified way and also present it and also use it for analytics. And we also presented the strength and the use of SNOMED into dentistry. And then they start to begin to understand. But then the problem is, how do we start to implement this? What kind of thinking mindset that we need to adopt to help to not just convince them, but to start the ball rolling?
Mm-hmm. So yes, dentistry has a lot of structured data, and the previous things we did, we showed that about 60 to 65% of the data are not only structured, but they're also very precise. So the workflow in dentistry is using graphics makes it very structured at a detailed level. But that really doesn't help us when everyone has their own coding system. And especially when that coding system actually creates ragbacks from structured data. It's really weird what they're doing at some point. So I think that's why we have been struggling so much. And like Kelly said, we talked about where we are in the process, blah, 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 blah. And it's moving so slow. So that's why we're hoping now, gathering the entire dental service, the public dental service in the country, is able to move the market. I don't really understand the problem, because if they use SNOMED codes as codes inside their system when registering structured data, the problem would be solved. we wouldn't have mapping, because what they're doing now is they're sending their codes here and their codes there, and another vendor is sending their codes, which doesn't correspond. They're not the same information model. They're not the same technical representation. So how to move them? I hope if they're not moving in the sensible direction, the market needs to move them. And the market right now is us. That's about 1/3 of all Norwegian dentists. So if they can skip us, they must have a really good business case elsewhere.
We still have some time. Peter.
Thanks, Jørn. I was really impressed by your post-coordinated work that you've done there. I think possibly because when we've looked at it, we've tried to account for every possible case, and we can't say how this is going to go. But you have a very specific domain, and I think that probably helped you pull it down into something that was actually more constrained. Could you say something about how you went through developing the model that you would use for those post-coordinated expressions?
So we started with seeing what kind of data do we actually have? What does it mean? Where does SNOMED has pre-coordinations that actually express what we mean? So some places we need to post-coordinate simply because there were no pre-coordinated concepts. But looking at that, we saw that it really didn't make sense doing this. And this is based on the work done in a national project in Norway that included all of healthcare, where we looked at a lot of using both post-coordination and expression constraint queries to build registry solutions and to document other kinds of things. And I remember, I see Karol sitting over there, worked a lot with with observations of blood pressure. And then we had a lot of help from him. Eirik was involved, and Ulrik Andersen was involved, and said, well, we need to tell them exactly what we're seeing. We're not putting a code that is a rag bag. And that's what we also used in dentistry to say, well, we need to give them the possibility of expressing what is actually there. Like the inlay, which is, of course, we can create gold inlay in SNOMED, but we can also say inlay with the substance of gold. And doing analytics, it really doesn't matter. And why did we do it like that? Because we also wanted to include anatomy. And when you're going into anatomy, everyone thinks, well, dentistry is 10 by 10 centimeters, so it's really simple. We probably have a lot of more codes than you use both in heart medicine and in orthopedics, because we're talking about 50,000 pre-coordinated concepts only for anatomy, if we don't get a model working. So I don't know if that answers your question. We looked at the use case. We saw what do we need to say, what we need to do analytics on, what do we need to transfer, how do we work on that? And we just said, well, do we have the attributes? Yep or no. Well, can we make them? Do we have the value sets? Do we need to constrain the value sets? So we started big and we merged in, and we're not using a lot of concepts. But it adds up to over 38,000 post-coordinated expressions from about, I think it's about 400 concepts. But that gives us everything. So why would we want to pre-coordinate 38,000 if we can make a robust model? And of course, in addition, it opens up the world, because now we have a post-coordination basis. We can add new information if that should occur without having to redefine everything and having a lot of release factors, blah, 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 blah. So that's the rationale, and that's the process we went through.
Well, sorry. Well, now we ran out of time, so that could close this session. To our online delegates, you're welcome to remain here for the next presentation in this stream, or you may navigate to another session via the event lobby. Thank you, Jørn and Eirik, for an excellent presentation.